This video will guide you through the interactive screens available in the iCAT Vision software. When the software is opened, the preview screen will be shown. This is divided into boxes. Shown in the top left-hand box will be the names of the patients whose data have been stored in the software. When you find your patient's name, click on it. Go to the box directly below and left-click on CT. If the patient has had 2 or more scans, there will be a list to select from. A box will be shown which will ask you to select a workup. At CT-dent, our technicians will format the scan data and create a workup for you. Click on the selected workup you would like to open and the scan data will load. You will now see on the screen a panoramic view at the top and below that sagittal, coronal and axial views. We will now look at the 4 interactive screens available for viewing the scan. To open up a viewing screen, go to the top left-hand corner and select the drop-down menu that says Screen. From the drop-down menu, you can select to view either the Implant, TMJ, MPR or KEF screen. We will now look at each screen in a little more detail. If we first look at the Implant screen, starting from the top left and going clockwise, we can see the axial view, the panoramic view, the sagittal cross-section views, and the 3-dimensional view. If we place the mouse cursor over the 3D view, a cross appears. Dragging this cross will enable you to rotate the 3D volume. The panoramic view, like the axial view, acts like a navigational map and can be used to identify and locate important reference structures. When moved over the image, the mouse cursor provides 3 functions. Moving the cursor to the central region shows up a W, which stands for window. Dragging the cursor in this location up, down, left and right will allow the brightness and contrast to be adjusted. If we position the cursor to the right of the image, Z shows. Standing for zoom, dragging the cursor up and down here will activate zoom in or out. If we now position the cursor to the left-hand side, the letter P will show. Standing for pan, this function allows you to pick up the image and move it around the box in which it is situated. These 3 tools are not limited to the panoramic view and can be used in the axial and cross-sectional images. If we position the zoom tool on the central reference slice, highlighted in purple, of the cross-sections, it will increase it in size, making it easier to use for planning implant placement. To return it back to its normal size, click again on the image. If we return to look at the panoramic view, you will see there are 3 yellow bars positioned beneath and to the right-hand side of the image. If you click on the center of the horizontal bar, you will be able to drag it from left to right. This is used to scroll through the cross-sections horizontally. Clicking on the solid blue dot allows the slice thickness to be changed. Selecting the center of the vertical toolbar allows for the height of the anatomy viewed in the cross-sectional and axial images to be adjusted. The diagonal toolbar can be used to adjust the slice thickness of the panoramic vocal trough shown on the axial view. To exit the implant screen and return to the preview screen, go to the drop-down menu that says Screen and select Preview Screen. Now we will look at the TMJ screen. This can be acquired by either selecting TMJ screen from the drop-down screen menu or double-clicking the axial view. The multiplanar and 3D volume rendering views on this screen allow the condyle and surrounding structures of the temporomandibular joint to be evaluated. Like the implant screen, image optimization is available through the brightness and contrast, zoom and pan tools, and the 3D volume can be rotated. If we now exit the TMJ screen and select the MPR screen, the multiplanar reconstruction screen has a very similar appearance to the layout of a traditional CT scan. There are axial, sagittal, and coronal reconstructions that can be scrolled through. Like the implant screen, image optimization is available through the brightness and contrast, zoom, and pan tools. Now we will return to the preview screen, but in a different way. If you move the cursor to the very top left-hand corner of the upper left box, a large cross will appear. Clicking this will return you to the preview screen. This can be done from any of the 4 interactive screens. The final screen to look at is the KEF screen. This can be acquired from the drop-down screen menu or by double-clicking the sagittal view. This screen is only useful for scans which have a 13 cm field of view and is commonly used to visualize and assess the complex relationships of the maxillofacial bones. The screen is divided into 6 boxes. The upper left-hand box shows an X-ray projection with highlighted soft tissue. The middle and upper far right boxes show left and right lateral KEF maximum intensity projection images. The lower left-hand box shows a coronal MIP image, and the middle lower box a mid-sagittal MIP projection. Again, like the other screens, image optimization is available through the brightness and contrast, zoom and pan tools. This concludes our navigation through the iCAT Vision software.